we own very own expert, the person God send. You understand? God give and like say, go and teach people or go and treat people. Do you understand? The doctor of our time. Looking elegantly dressed. I knew he was going to be around this morning. I guess so. He is around. And I'm happy about the fact that, yes, now still on top of what they talk about before. Of course, what is trending right now, within the share, within the affect, not just Nigeria, but stylishly, don't become like a global emergency. Okay, so ladies and gentlemen, of course, I wouldn't be doing justice to that when Dr. Barth is here. So join me as we welcome Dr. Barth this morning.
Thank you. Slimmest of
Good morning, my doctor.
Thank you.
Now, I needed to compliment. No, doctor, your outfit
I'm
is
so flattered. Thank you. You're looking sweet as always.
Thank you, sir.
Yeah, good morning, viewers at home and around the world. We'll be continuing with the topic we started some few weeks ago.
Yep.
That is the talk of the town.
Yes, sir.
Monkeypox. What is it all about? On the 23rd of July 2022, WHO has declared, or on that particular day, WHO declared it a global health emergency. That is the highest degree of alert, health alert, that can be given by that United Nations body. Okay? Also, on the 4th of August, United States of America also declared monkeypox a global public health emergency for their own, of course, country. So it is the talk of the town. As we speak at the moment, the confirmed cases in the US are over 10,000.
Wow.
And it has affected over 90 countries of the world. This is something that has been in existence in Africa for decades. And little or nothing was done about it, and now it has become a global health emergency. As we speak, the global tally as of 12th of August stood at 31,655 deaths that have been recorded globally. That's fatalities. The number of people who have lost their life is actually said to be 12. But when you include Africa, where we actually have challenges with statistics, it's more than 100 that have died. NCDC said Nigeria has reported 157 cases with 4 deaths in recent time from the outbreak that actually started sometime in May.
Yeah.
A little bit of history, but first we want to make an attempt to define what monkeypox is. It is a viral disease that is caused by a virus. When we talk about viral diseases, we are talking about diseases that are caused by virus. So it's a zoonotic disease that is caused by monkeypox virus. Also, on August 8th, the WHO had meeting with our partners and experts where they actually tried to change the nomenclature of what we used to know about monkeypox. Instead of talking about the Central African clade, and of course, the West African clade, you now have clade 1 and clade 2. The Central African clade, the one that emanated from Congo, is now called clade 1, while the West African clade is now called clade 2. The West African clade actually has 2 subtypes, clade 2A and 2B. So we'll hear more about the nomenclature. Why is it all about? A lot of people felt that the monkeypox name offends some culture. It's not good enough. It sounds discriminatory. And of course, WHO muted this idea some 2 months ago that they were going to do a name change. Okay, but it's beyond the name change. The truth of the matter is the monkeypox is spreading like a wildfire. This was a disease that was first identified in Africa in a child, in a 9-month-old child in the year 1970. Okay, but it was first isolated in the year 1958 among a colony of monkeys that were kept for research. It wasn't until 1970 that the first human case was identified, and that happened in Congo DR a 9-month-old baby was said to have been infected with this monkeypox virus. And ever since then, there have been sporadic outbreaks in majorly Africa. And when you talk about Africa, predominantly in Western Africa and, of course, Central Africa. That is where we have sporadic cases. 2 major clades have been identified over the years, clade 1, as it is now called, and clade 2. The clade 2 is one that is found in Nigeria and a number of West African sub-regions, and it appears to be the one that is predominantly circulating across the globe.
Okay.
It is known to be less severe to clade 1,
Okay.
which is actually the Congo Basin clade, the one that is found predominantly in Congo. And this causes a lot more disease than clade 2, the one that emanated or associated with West African sub-region. Let's talk about the symptoms that can identify this disease. How does it present? How can somebody on the street, pick out this disease? Maybe from somebody who lives around you, who works in the same office with you. Okay? There are unique things you need to look out for. But all of that are beginning to change. We'll talk about that, signs and symptoms. Number 1 is that people who are affected with this disease may present with fever. They may present with weakness. They may present with myalgia. The most significant feature is actually the development of lymph node enlargement. Okay, but there's these eruptions that are usually found in people who have this disease.
Okay.
It usually starts with the face, skin eruptions or rash, if you like. Usually starts from the face and spread towards all other parts of the body. It could range from 1 to thousands in one individual. But the newer presentations we are seeing are actually coming with fewer rash and can be found in virtually every part of the body.
Wow.
Even in the genitalia, that's the male and female organs. The rash could spread as much as those areas of the body. Okay? And how do we pick it? Of course, we have said there is a zoonotic disease, meaning that it can be transmitted from animal to man. It can also be transmitted from persons to persons. That we have said before. A pregnant woman can actually transmit it to her unborn baby and can transmit it to a baby that she is feeding shortly after birth. Okay, so you need some degree of close contact for the transmission to occur. And that is why today we know that some certain population groups are a lot more affected than others. Okay, so the cases in the US are predominantly found in a certain population, and this is the population of men who are sexually exposed to fellow men. Okay, so they form the bulk of the group that are mostly affected by this scourge. And that is why what brought the idea of sexual transmission to the virus. Is this sexually transmitted? The scientific community has not been able to convincingly answer that question. But what we do know at this time is that the virus can actually be found in the semen. The DNA of the virus can actually be found, has been reported to be found in semen of individuals who are infected. And as a result of that, part of the guideline that are given to people who have been infected, even after you have recovered, you're expected to use protective means. Okay? When you're exposed to sex, you need to protect yourself by the use of condoms 12 weeks after you have recovered, so that you don't infect other people. Okay, so the infection could come from close contact, prolonged close contact with an individual. It could be skin to skin, it could be mouth to mouth. Okay, it can also be picked from bedding, clothes that have been used by an infected person.
Dr. Barth, because the truth is, when I watched the stuff on a news channel, that's for the US, I was wondering why they declared the public health emergency. For me, is it not the same thing? Or are they just trying to shy away from that word? Because they're quite confusing. Global, public, I mean, they are quite similar, but still confusing at the same time.
Thank you very much. Thank you very much for that question. Yeah. before I take that question, I want to read what I have here.
Okay, sir.
It was coming from the acting head of African CDC, Center for Disease and Control. Okay, Ahmed Ogwell. He said, and I quote, "The solutions need to be global in nature."
Okay.
He said in a warning to the international community, if we are not safe, the rest of the world is not safe. Bam. Now, this monkeypox was once referred to as neglected tropical disease. This is a disease that has been in existence, at least mankind can associate with it, since the year 1970, when it was first discovered in that little child in Congo DR. Okay, so the disease truly has been neglected, and
much attention was
paid by the international community, and the reasons are not far-fetched. Okay, I can tell you, and that's why I want to come to your question. The reason why it was declared a global health emergency of public importance, okay, was because of the widespread in outside of Africa. Because we have been with this, the warnings has been there. The warnings have been there over the years, okay, but not much was done by the international community until this time around. Now, the essence of declaring a disease, raising that degree of alert to the highest level, is to improve coordination, cooperation, within nations, and of course, solidarity. Okay, so that's the essence of taking it that high, and that will bring about deployment of more funds to tackle the disease on a global level. Okay, so WHO did that, made that declaration on the 23rd of July 2022. America wasn't forthcoming with joining the WHO until 4th of August. Apparently, when they saw, and of course, you need to, certain parameters need to be met before you can actually, it's not someone does not just wake up and say, because of the head, so it's a collective decision. Okay, so that's what I can say on that. Okay, so they waited till they have their own, when they were sure of their own facts, at least in their environment, to also do the same. Okay, so, and I can tell you, between when they did that and now, at the time they did that in the on the 4th of August, they had about something beyond 6,000. And as of today,
you mentioned 10,000.
Yes, as of 12th of August, it has gone past 10,000. Wow. Specifically, they now have in the US 10,687.
Wow, that's close to 11.
Yes, yes. Now, and of course, in the last, according to WHO figures, globally, we have about 31,655. And in the last 7 days, globally, in the last 7 days, over 5,108 cases were recorded. In Nigeria, too, in the last 1 week, we have had 24 new cases. So our own figure has risen from 133 or thereabout to 157 at the moment, according to NCDC. And of course, you can see the spread. We are being told to get to brace off for the challenges that are coming with this disease. Okay, so everybody, the sensitization needs to be there. Okay, so that's why we're hammering on some of those things you need to look out for. Yes, which predominantly is the skin eruptions, the rash that individuals who are infected usually will come up with. But that is not to say that it is only monkeypox that is a disease that can actually give such rash. No. Other diseases like chickenpox can present with that, and that is why sometimes it's often very confusing to differentiate between smallpox and chickenpox. But like we said in some of our previous presentations, one significant thing with monkeypox is the development of lymph nodes, swollen lymph nodes. Thank you very much. Lymph nodes are usually, let me remind some of us who may not know what lymph nodes are. If you have an injury, you remember back in when we're young, if you have an injury, it could happen to anybody though, it doesn't have to be young people. If you have an injury anywhere on your hand as gets infected over time, you have a swelling on this armpit. If it's on this side, you have something similar. If it's on the leg, you have something similar in the groin. Now, those are lymph nodes that are usually found in people who have this disease. That can differentiate it from some other rash-causing disease. The rash too can be somehow unique because usually it starts, the presentation and the sequelae of the development of rash is somehow unique as well. Usually it starts as flattened surfaces.
Okay.
It could be raised over time, okay, and over time it could be filled with fluid, in which case you will have pustules and vesicles before it will start developing crust and scabs and busting. And while this is happening, there will be an underlying skin, that will probably replace that. That's part of the things that will enable you to know that the person is recovering. What is the incubation period for this disease? 6 to 21 days is said to be the incubation period. What does incubation period mean? The time of picking the disease to time it start manifesting symptoms. Okay, and let me also say that not everybody who end up getting infected with this disease will come down with severe disease. However, some certain people, groups in the population may end up having a worse outcome than others. Which are these set of people? Usually in children or people who are immunocompromised, people who are living with HIV/AIDS and some other immunocompromising illnesses, leukemia, diabetes, and a good number of them. Okay, so these people may come up worse off if they are infected with this disease. Other than that, other than this set of people, usually for all other people in the population, it is more or less going to be a mild disease. I also read that there could also be asymptomatic presentation. People who may have it but may show no symptoms, that they may show no rash at all. That also has been documented. Okay, so we need to look out for some of these things. Okay.
Okay, so doctor, I don't know, why is Africa worst hit? Is it because of what is actually responsible? Because I know that in that video they say we should not talk about racism and all of that, but then why is it that most times when it comes to things like this we are always very hit?
I won't say this time around that Africa is worst hit. The goalposts appear to have changed. Okay. The epicenter of this virus is Europe. Okay. I don't think with what we are seeing in the US whether Europe will still return that title, unpopular title, so to say, or unholy title, so to say. Okay, with what we are seeing in the US, topping 10,000. Okay, but in Europe is still doing a whole lot of havoc. Spain has about 5,162. UK has recorded 3,1017. France has recorded 2,423. Okay, these are some of the, in terms of fatalities, in terms of deaths, an individual has died in Brazil, one person died in India, two persons also died in Spain. Okay, but in Africa we've lost close to 100, if not more. And even at that is even an undercount, because we do not have we don't have statistics. We don't keep good data in this part of the world. Okay, so we may not be the worst hit, because considering the numbers we are getting from the Western world, okay, but however, it's actually was said to have started from Africa. Okay, talking about that little child that had it sometime in the year 1970. Now,
okay, doctor, please let me just open the phone line so that you know, go just blessing only me and Dr. Barth inside the studio. I mean, the show is basically for those persons where they watch us from any part of the world. So if you want to know more, you've got questions like I did ask doctor right now, things where they unclear, or you even see somebody will get all of these symptoms where doctor don't talk about this morning, please feel free. Call the numbers you can see on your screen. You can call us through phone calls, or you can like to video call us. I mean, the big screen is here for you. You know, just in case you want to see doctor, you want to see him face to face, and you want to ask your questions directly to him. So turn down the volume with you on your TV set, and obviously go ahead with your questions. You can go on, sir.
Yeah, somebody was asking me if I have monkeypox. For somebody who has suffered monkeypox in time past, will such a person end up picking it up? Okay, my answer to that question. Okay, so let's take
migrate, I guess.
From Plateau.
Margaret from Jeff.
Oh, Margaret. Apologies. Good morning.
Yeah, good morning, Margaret.
Margaret, turn down your volume, please.
The volume?
Yes, it is loud. I can hear myself. Turn it down. Okay, she will call back. Please, I just been talking now when I open the lines. Help us reduce the volume with your TV set so that we can hear you well. Go on, sir.
Yeah, so the person was trying to find out if someone who has caught monkeypox, who has
Before.
suffered from monkeypox in time past, could have it again. My
What's the
answer
answer?
is simple. For now, there is no scientific answer to that question.
Okay.
But we do know that a number of viral infections like chickenpox,
Yes.
measles,
Measles.
yeah, yeah. So some diseases are like that, but that's not for monkeypox. There is no scientific backing for that yet. Okay.
Okay. I'm sure they know that now.
Now, another question I got, is there a test to check whether someone has suffered monkeypox in the past? Okay. Yes, there are tests that can be done to see if somebody has been exposed to monkeypox in the past. Okay. You can actually pick out somebody who has been exposed in the past, somebody who also has had smallpox vaccination in the past, which is no longer widely available at this time, can also show. Okay, because smallpox vaccines was what was used to eliminate the smallpox infection many years ago, since 1980 when it was eradicated. But thankfully, that same smallpox vaccines are still what is being used today. It started to have about 85% efficacy in preventing monkeypox.
Okay. So, doctor, talking about this vaccine that you just mentioned now, is it going to be available for everybody?
That's the sad story.
Wow.
The sad story is that these vaccines are not available as we speak in the whole of Africa. So our 1.3 billion people that we have in this part of the globe can actually not lay hands on that. However, the authorities concerned are making frantic efforts to approach the international community to see how some of these vaccines can actually be made available. And promises are being made, but the CDC,
but is it going to be for everyone?
No. It's not going to be a picture that we have in COVID. It's not going to be mass vaccination. It's going to be target vaccination. Certain group of people that are at higher risk of picking this infection, will be considered first. And of course, that will include health workers and people who are probably immunocompromised and all whatnot. Even in the US, the vaccines are in short supply. Okay, people who want to get the vaccine can actually not lay hands on the vaccine. Okay.
That's it, because I think I just needed to clear that. Unlike COVID, we had everyone going for the vaccines and stuff. But I just hope, say we'll get them, because that's always the issues we have. But doctor, you also talked about we in this part of the world having issues with statistics, because I feel say number gas do has a lot to play when it comes to because the number of persons infected, you can know how to follow up and all of that. So I don't know, why do you have issues with that?
Basically, I think it has to do with the fact that we're developing nations. Okay, so it's not just the health sector where we have gaps to cover. It happens in almost every other sector. Okay, so that's what I can attribute to that. Okay, because that's areas where we need the WHO and some other international health organization to assist us. Of course, that's where they are rendering their support in areas of surveillance and of course preparedness to be able to tackle the next outbreak that may break out. Okay, someone sent me a question. Can the monkeypox virus be spread through a blood transfusion?
Wow.
Yes, because if people can pick it in the course of having sexual exposure, people are now thinking.
It's true now, let them ask. To be
that answer is also not possible at this time. A lot are still not known. Okay, so it's still a subject of research.
Doctor, because blood is inside, and if a pregnant woman can pass it to her child, so that I don't know, I'm just saying.
No, it stands to reason.
Because if it's something that can be passed even for a child,
it's not like HIV, hepatitis B and C that can actually be passed across from one individual to the other. Because if monkeypox happens to go that route, or that it happens to take that trajectory, it then means that it will have to be included on some of the things you need to screen. When you want to do blood transfusion in this part of the world. But because majorly for you to do blood transfusion, there are tests that
That you
you
have to
must do. Of
okay.
course, one of them is HIV, hepatitis B, hepatitis C, and a lot more others that you need to do to find out if anybody's blood contains that. Such blood will not be fit for. Yes, will not be fit.
But then, doctor, do you think we are creating, I don't know, necessary awareness? Because it just like now only WAP TV now they talk about this. I'm not seeing much publicity, unlike the time of COVID. Yes, because COVID is still being talked about. I mean, NCDC, they give dates, they give us number of persons on a daily. I mean, I have stations where they talk about coronavirus. They legit give update on that every day, but they hardly talk about what is happening now, talking about monkeypox. So do you think we are doing enough in terms of publicity, or we still have so much to do when it comes to creating awareness to this?
We are not truly and sincerely speaking, I don't think we are doing enough in terms of creating awareness about this disease. Okay, and a lot of factors could be responsible. Okay. One of which I think is the fact that smallpox is not monkeypox, I beg your pardon, is not as deadly as COVID-19. Okay, that could be one of the reasons. Number two is the fact that because he has been with us for years, people will feel reluctant about it. Is it not this disease you said has been in Africa since 1970?
But it wasn't talked about. Wasn't this much talked about?
Because it was once touted to
but
be.
Now we are recording in numbers.
Yes, a neglected African tropical disease. All
right, doctor. So I've got a few questions here. First off, I want to know the risk of monkeypox to pregnant women, and then secondly, would you advise pregnant or breastfeeding women to stop breastfeeding if they are infected with monkeypox?
Thank you very much for that very good question. Now, coming to your question, what are the risks
that
monkeypox could pose to a pregnant woman? Now, we do know that a number of diseases can adversely affect people who are pregnant. Okay. And of course, monkeypox is one of them. Okay, the risk that it could cause is enormous. Number one is the fact that it could be transmitted to an unborn baby. And we have said that one of the groups of people who are who may have worse outcome if they're infected, that children are part of it, as well as people who are immunocompromised individuals. So it can cause a number of challenges in pregnancy. It can even cause IUFD, okay, intrauterine fetal death. Okay, but like I said at the beginning, some of these things are not yet entirely covered in terms of they're still subject of ongoing research in a number of places. Okay, because the focus that is being given to monkeypox as a disease has never been this robust, has never been this elaborate. Okay, and the reason is not far-fetched. WHO has declared it global public health emergency. And of course, with that comes a lot of attention. Okay, a lot of works are ongoing, even in terms of treatment, diagnostics. A whole lot are currently ongoing, and we are still going to talk about quite a number of them. Okay. Now, will I advise a breastfeeding mother who is infected to stop? That advice will be better given by the breastfeeding mother's healthcare professional or doctor. Okay, it will be better given by her doctor, who may be privy to some symptoms. Okay, that remember we said it's not everybody that gets infected that will have severe disease. WHO DG actually said that 10% of people who are infected may end up hospitalized. So it's not everybody that could come in this category. So is the person, the healthcare professional, the doctor who is seeing and interacting more with the patient that will be in a better position to give such an advice. That said, in medicine we'll talk about if the risk outweighs the benefits. Okay, so we'll talk about the risk outweighing the benefit. All those will be looked at. Okay, but if you feel that not asking the woman to breastfeed can actually deprive such a baby of useful nutrients that can make that baby to survive and thrive, okay, you may actually ask the woman to go ahead and breastfeed and see if the child ends up picking the disease, it can be treated. But like I said, it is a decision that will be better taken by the doctor who is managing this individual, who may be privy to one or two extra information that may not be available to us, keeping in mind the question you asked. Now, I want to talk about how the disease can be diagnosed. Okay. Now, in talking about diagnosis, we need to have a high index of suspicion. Okay. People who present with such skin manifestation need to be properly cared for. Okay. And for healthcare professionals, we need to imbibe the culture of taking universal precaution. Okay. Until otherwise proven. Okay. So that means if you have someone coming into your facility with widespread skin eruptions, you should start by avoiding taking vital signs with the usual pattern. Okay. Exposing, because that will expose, if you probably use something like the Sphic to take vital signs of such an individual without knowing that that could be, you can use it in the next 1 or 2 persons, so that way you encourage the spread. Okay, so precautions will start from that point. If you need to take the vital signs, you have to probably put a covering, make sure that the person is firmly covered, and of course keep your distance before the person gets to the consulting room. Okay, you may inform the doctor, give the doctor a prior notice that somebody with such skin manifestation is actually coming in, because you need to expose the doors and windows. Don't forget, the disease can be transmitted through droplets, okay, but not as much as aerosolized droplets, but not as much as we have in COVID. With COVID-19 and everything. Now, when you collect the patient and you think the patient may be having such a problem, okay, in this part of the world, we have centers where we can refer such individuals, where they will be properly managed. In Lagos, for instance, we have the infectious disease hospital at Yaba, where we usually refer people with infectious disease that can be managed in private hospitals. Like I said at the beginning, it is not everybody who gets infected. Just like some other viral infection, it could also be self-limiting. What does that mean? The disease can actually, the infected individual can actually overcome the infection over time with or without taking drugs or any form of medication. But for that percentage, 10% of people that may be affected, that may require hospitalization, those are the ones that we are talking about. Okay, so once you make that, the next thing to do is to take samples, okay, for investigations. You need to take blood samples. A number of investigations may be necessary. You need to have an idea of the full blood count for people who are medically inclined. ESR, these are expected to, and some other viral markers that are expected to rise beyond normal limits. And of course, the skin eruptions can actually be taken. The gold standard is to do a PCR, polymerase chain reaction.
Okay, Doctor, I might just have to hold you up here because we need to go. I think we've actually done so much today. For those who maybe missed the previous episode on top monkeypox, please feel free to go watch that on our YouTube channel at WAP TV. Just search for WAP TV, comes up, and then you can always watch it. Thank you very much, Doctor.
So
our time flies. Yeah, time is.
So we'll see you again.
Yeah, so obviously, Doctor and his apprentice. I'll see you guys.